So really, this is just an overview of what we're going to cover this afternoon. So we'll start off with just a reminder about the different roles of the deaneries and the colleges, what the derogations are for this year for the ARCP, then moving on to the transitional arrangements for the move to the new curricula, how to prepare for the ARCP, a very quick overview of the decision guides which are already on the website, and then who to contact for the different queries. We're also going to be covering internal medicine and the requirements for those. So if we can kick off, please, Jenny. So this is really just a reminder for everybody. I'm sure most of you don't need reminding about the different roles and responsibilities of everybody involved in postgraduate medical education. So the college will set out the curriculum. We agree the ARCP derogations, which are also approved by the GMC and the statutory education bodies. And then obviously the deaneries then roll out the ARCP process, and we work together to make sure that trainees are progressing through training, and we'll also be working together to make sure that trainees that need to are transitioning to the correct curriculum. There is a new gold guide apparently due to come out quite soon, but it's not out yet. So the gold guide that's pictured is the one that is in place at the moment. Next slide, please, Jenny. Okay. So as most of you will know, or all of you will know, this will be our third year of having ARCP derogations in place as a result of the COVID-19 pandemic. We have worked with the Joint Royal Colleges of Physicians Training Board each year just to put those in place and to make it clear to trainees, trainers and TPDs what is required and what flexibilities we will put in place in order to allow trainees to be able to progress through training. And this year is no exception. We have ARCP derogations in place again, although this year they are really not that different to the ones that were in place last year, and you'll be able to find those on the website of both colleges. Next slide, please, Jenny. So then the added complication that we have this year, or the added process that we have, is that we also have new curricula that were introduced last August, really due to a number of factors, but primarily because the approvals were received fairly near to August 2021, and also we were aware that we had trainees who were working their way through a second year of disruptions training due to COVID. We made the decision jointly to introduce the curricula only for ST3 trainees last year, but this year we're now looking to move all of the remaining trainees over to the new curriculum. The only exception to that is trainees who have a provisional CCT date, which is on or before the 31st of August 2023. We're basing all of our transitional arrangements on the guidance from the GMC, who consider that 2 years from the date of the curriculum implementation is a reasonable time for trainees to transition. The other point just to make is that although that date there is in bold and underlined, we do recognise that some trainees may have a CCT date close to the 31st of August, but just over the line in very early September. So we're prepared to be flexible with those trainees, and we're encouraging everybody just to contact the relevant college just to confirm whether or not they have to transition. So for example, if your CCT date is on the 1st of September 2023, we probably won't make you transition. Next slide, please. And these are just the general principles that we have set out around how curriculum transition should take place. So once trainees who need to transfer to the new curriculum have moved over, then you can't move back to your previous curriculum. And also when you move over, you would be normally expected to proceed to the relevant specialty training. So for example, if you've completed ST4 on your old curriculum and everything is well, then you would proceed to ST5 in your new curriculum. We obviously have to make sure that we're maintaining all the right standards and that there is fairness and equity for all of the trainees. So that's where some of the flexibility that I've already mentioned comes in. But there will be opportunities for trainees who have particular circumstances to contact one of the colleges, and we can deal with those on an individual basis. We obviously have to make sure that the curriculum capabilities and mapping is being undertaken as well by the LETBs and the deaneries, and we really do want to minimise disruption to the trainees' progress as much. Again, part of the reason why we've slightly delayed it to this year. Next slide, please, Jenny. Hey, Zoe, do you want to cover portfolio transition?
Yes, sure. Thank you, Jo. Because JRCPTB, as you know, manages the ePortfolio for the infection specialties. So just to update you on this, new programmes and curricula will be added to the trainees account for those who are transferring. The GMC does encourage trainees to transfer at an appropriate point, which would normally be the start of the next training year. So we will have details of the training levels and the training level dates. We'll transfer trainees on the most appropriate date. This will give you access to the appropriate curricula, the adapted multiple consultant reports, the ES report, everything that it applies for the new curricula. There's also on the website a gap analysis form. There's actually a gap analysis form for Group 2 specialties and one for Group 1. So we encourage people to use it as a way of recording that discussion about mapping the previous curricula to the new curricula and identifying any gaps, but assuming it will be relatively light touch for many trainees, as there hasn't been significant change to the curricula in terms of the learning and the training programme. But there are forms there provided to record that. Trainees should not be required to relink or transfer evidence in the curricula. They can refer to the previous curricula, it will still be there with all the evidence, but they should start using the new curricula from the point of transition. We will be providing a form for those who are being given exception or exemption from transferring to the new curricula for the reasons that Jo's just outlined. We'll be providing a form so that can be recorded on the ePortfolio. We will not transfer those trainees, and also the trainees who are in their final year of training will not have the new curricula added to their account. I'm happy to answer any questions about this at the end as well with the Q&A session. Thanks. Back to you, Jo.
Lovely. Thank you. Thanks, Zoe. So just to review what the recommended minimum data set is for the ARCPs this year, and as I've said, this really is very similar to what we recommended last year. So very straightforward for trainees to put all of their workplace-based assessments that they've completed, make sure that they have those and linked appropriately in their ePortfolio. Any cases that have been undertaken, if they've had to do any form of multi-source feedback, obviously that should be in there. If one's not been required, again, it should be clear why and what the plans are for that to be done the following year. There is opportunity to provide evidence of suitable and appropriate alternative evidence for trainees who may have done additional things or done things slightly differently this year, and there is some guidance available in the curriculum for that. And then obviously any exams that have been completed, including during COVID-19, not just prior to. So those can all be put into the ARCP for consideration by the panel. Next slide, please, Jenny. And then this year, just because it's slightly different year with the ARCP and then the preparation to move curricula, we're recommending that trainees find some time perhaps to meet with their educational supervisor just to discuss the transfer in preparation, and review what has been done in their training, and then highlighting any gaps so that there can be preparation for how that's going to be addressed when the move to the new curriculum takes place. And just to reiterate, the point that Zoe made, so once the trainees move over and once they're on the new ePortfolio for them, then they just obviously carry on completing any assessments that are required for that particular curriculum. So no need to go back on anything. Next slide, please, Jenny. Seems straightforward, but probably worth making the point that trainees will have to make sure that they complete all of the curriculum requirements in order to be able to be eligible for the award of the CCT. And as I've already said, there is a little bit of flexibility around this 31st of August 2023 date. So if you have a trainee with a CCT shortly after then, please do encourage them to get in contact with one or both colleges, depending on what they're doing, so that we can make an agreement with them around that. We do want to be flexible where we can be. We also know through discussions at some of the training committees that there are some trainees that have exceptional circumstances, or where their training may have taken them off down different pathways and things, and it's something that we might need to look at more individually. So again, please do contact so already. If you have a trainee in that situation, we're very happy to look into that. We've contacted the General Medical Council about 1 or 2 trainees to get some further advice, and again, we're very happy to do that. So there's contact details at the end to make it clear who to contact for those things. Next slide, please, Jenny. Okay, and then this is just really an overview. This information is already on the college's websites, but this just gives you an overview of the recommended outcome for the ARCP, depending on the circumstance of the trainee, but then also a recommended action about what they should be doing in terms of curriculum transition. So these are very broad, very high level. They're not intended to go down into very much detail. And as I've already said, any questions or any trainee that perhaps doesn't quite fit into any of these examples that we've given, then you can contact the colleges. So these ones are fairly straightforward. And then there's just one other, I think, Jenny. Yeah, so even more straightforward for these ones. So as you can see, you know, really the point to reiterate is that any trainee within the next year will not need to transition, so they'll just stay on the curriculum that they're currently on. And I think that was my final slide, if I'm right. Next slide, please, Jenny. Great. So if I can hand over to you, please, Alastair.
Great. Thanks, Zoe. Joey. So Joe. Thank you. So I'm going to be talking about how we are integrating internal medicine training with infectious disease training. So this is really largely only relevant to those of you who are supervising or doing IM, so infectious diseases with internal medicine. So infectious disease is one of the more complex curricula that we manage. As I say, we manage 30 curricula altogether, and ID is definitely complex because, as most of you will know on this call, it's both a group, it's the only specialty that is both a group 1 and a group 2 specialty. So at the JRCPTB, most of our curricula are what are called group 1 specialties. That is, they are all dual training with internal medicine. So you can't complete training in specialty alone, you have to complete training in the specialty and internal medicine. And then we have some other specialties which are group 2, where they traditionally didn't really train with general medicine, such as sports and exercise medicine, aviation and space medicine, rehab medicine, etc. So ID is a group 1 and a group 2 specialty. It's a group 1 if it's combined with internal medicine, and it's a group 2 if it's combined with med micro or med virology. So this is for the ID IM trainees. So next slide, please. So the internal medicine curriculum is in 2 stages. The first part of internal medicine training stage 1 is a 3-year program. If trainees are going into a group 2 specialty, they may leave that program at the end of 2 years, and provided they've got an outcome. I can't remember whether it's a 1 or a 6 now, but anyway, they've completed training satisfactorily. At the end of 2 years, they can enter a group 2 specialty at a higher specialty training. But for those who are going into a group 1 specialty, they complete 3 years of internal medicine stage 1 and then go into higher specialty training in an integrated program with their specialty and with internal medicine stage 2. So the IM stage 2 curriculum is identical whether you're doing cardiology, whether you're doing respiratory medicine, or whether you're doing infectious diseases. And these are the curricular requirements of the internal medicine stage 2 curriculum. So these are GMC approved, they can't be varied or changed, and they have to be implemented. So everybody who is doing internal medicine stage 2 over the whole 4 or 5 year period of their high specialty training must see 750 patients presenting with acute medical problems, which essentially, for practical purposes, means on the acute unselected take. And of course, that's a pretty easy ask, because those of you who do acute unselected take means it doesn't take very many AU2 sessions to build up your 750 patients. You have to see 100 patients in the final year. And in the final year, what we want to do, the aim of these programs is that somebody, or the aim of the ID-IM program, is that when somebody completes training, gets their CCT on day 1, they could be running an acute take in a busy general hospital with very little support from colleagues, or they could be running an acute ID unit, getting lots of acute infectious disease admissions. So people have to be fully trained in general medicine and in infectious disease. So to that end, in the final year of training, anybody who's doing ID plus internal medicine has either to spend 3 months, during which time they're doing acute unselected take on a regular basis, or in order to sort of really get them consultant ready, they have to spend 4 weeks fully immersed in an acute medicine unit. So those are the curricular requirements. So next slide, please. Anybody completing internal medicine stage 2 must be involved in the continuing care of people admitted with acute medical problems. Well, that is clearly not a problem for ID trainees, because you will, the whole time that you're on the ID wards, you will be looking after patients with acute medical problems. So that's not an issue at all. Bullet point 2, everybody, we're keen that people have a perspective on that, on internal medicine that's sort of out with their specialty perspective. So we want people to be looking at the breathless, if they're a respiratory physician, we want them to be looking at the breathless patient with through a cardiology lens or through a diabetes lens, and that applies to ID. So in addition to your requirement to do ID clinics, you need to do 20 clinics in a non-ID specialty. So for example, you could do 20 respiratory clinics, which would obviously help in the management of your TB patients. You could do 20 hepatology clinics, which would obviously help with your patients with viral hepatitis, etc. So, and they don't all have to be in the same. So you can do 10 clinics in one and 10 clinics in another. That's as a minimum, and many people would probably want to do more, in fact. And then the third requirement there is that anybody doing it as a group 1 specialty with internal medicine must have an educational supervisor for internal medicine. So that could be their ID educational supervisor, preferably if the ID educational supervisor is practicing in internal medicine, or at least CCT'd in internal medicine. It's not absolutely mandatory, but preferably the ES for internal medicine should be actually a card-carrying ES doctor. If they're not, they need to make sure they get very good input from the clinical supervisors for internal medicine to ensure that they're giving an accurate ES report to the ARCPs to make sure that the trainee is progressing adequately in internal medicine, in addition to their progress through the ID curriculum. Next, please, Jenny. So remember, of course, that everything that we write is guidance. It's not mandatory. It's the so all our timings and durations are quotes indicative. The other thing is that, of course, infection trainees in the CIT, as you know, that's 4 6-month blocks, but in most training programs, it would tend to be that there's a year of predominantly clinical-based training where people will be doing their ward-based clinical ID together with perhaps their consult service or more likely perhaps their outpatient commitments. And then they'd be doing a 12-month period when they're more predominantly lab-based, when they'd be doing their lab stuff together, again, with probably with consults. And so during that 12 months of primarily laboratory-based training, although obviously recognizing they're out on the wards doing a lot of clinical as well, but the 12 months of predominantly laboratory-based training, the trainees do not have to do acute unselected take during that time. However, once they go into higher infection training, that's the final 2 years of training, during that period, they will have regular commitments to acute unselected take. And again, in none of our specialties have we defined what we mean by regular. It's people have to do enough to demonstrate that they've achieved the appropriate capabilities in practice. So that really sort of describes all our approach to training now. We're less interested in time spent and much more interested in people demonstrating they've achieved the requisite capabilities as defined in the curriculum. Next slide, please. Yes, I think I've already said this when I was talking about the ES. So every trainee in ID and IM must have an ID educational supervisor and an IM educational supervisor. As I've said, it could be the same individual who ideally practices in both specialty and in IM. And if they don't practice IM, then and that quote there is directly from the curriculum, they must obtain and consider detailed feedback from the clinical supervisors who are familiar with the trainees' internal medicine practice. And so it's all about ensuring that internal medicine is regarded as equally important with the with ID training. Next slide, please. And that's my lot. So thanks for that, Jenny and Joe, and I'll hand back to Joe to finish up.
Thank you, Alastair. So as I've said, there may be lots of reasons why trainees or TPDs or supervisors might want to contact the colleges. So these are just the contact details for both colleges and some guidance about who to contact. If it's about the running of your ARCP though, when your date is, what the arrangements are and all of those kinds of things, and obviously it's your local deanery that will be able to guide you with that one if you're a trainee.